Hi, today we'll be discussing what causes bleeding between menstrual period. If you are new to my channel, my name is Dr. Nkiruka Bridget. At OBGYN Talks with Dr. Adazion, I discuss everything about women's health, children's health, and sometimes men's health. Bleeding between menstrual period. There are a lot of things, different things that can cause bleeding between menstrual period. Some of the causes may not be something to worry about. However, some may require you seeking medical attention. If you are really worried about bleeding between menstrual period, you should seek medical attention. There are causes to bleeding between menstrual periods, and these include hormonal contraceptives. For someone that is on combined oral contraceptives, intradermal patches, intra-implants, or progestogen-only pills, this can lead to intramenstrual bleeding. We actually call it intermenstrual bleeding. So the person might have seen her period, and before the next period she's seeing spotting or she's seeing some form of bleeding. This may be the cause of this. Or even someone on intrauterine contraceptive device, the one you put inside the womb. This may be the cause of intermenstrual bleeding, that is bleeding between periods. However, this bleeding is not supposed to last more than few months. When it starts lasting more than few months, the person is required to seek medical attention. Then, someone that has missed any of our oral pills, for someone on combined oral contraceptive pills, and you miss some of your pills, you may have intermenstrual bleeding. Someone that is on an emergency contraceptive pills. Emergency contraceptive pills is one of the contraceptive methods used to prevent pregnancy, especially in cases of sexual violation, or someone that mistakenly had intercourse without protection and does not want to get pregnant. Emergency contraceptives are what to be taken once in a while, but when you make it a habit that every time you are taking emergency contraceptives, it may lead to bleeding between periods. Remember that emergency contraceptives are also hormonal pills. These are the causes of intramenstrual bleeding following hormonal pills or someone on combined oral contraceptive pill. If you have not subscribed to my page, please subscribe now at OBGYN Talks with Dr. Adazion. Follow me on Facebook, Instagram, and TikTok. I'm also there with the name OBGYN Talks with Dr. Adazion. Share this video. Now let's move on. Other causes of bleeding between periods include what we call coital laceration, when there is vaginal injury following penetrative sex, especially when it is done without consent. That's number one. Or when it's forcefully done, or when it's not preceded by enough foreplay, so that the vaginal mucus will lubricate the part. So the person may have injury to the vaginal walls and may think that she's having bleeding between periods. That's another cause of bleeding between periods. Someone that is recently having a miscarriage doesn't even know that she's pregnant, but however she's miscarrying that baby, she will think she's having bleeding between periods, not knowing that she's recently having a miscarriage. Someone that has a sexually transmitted infection may have bleeding between periods, and the commonest is infection caused by chlamydia species. So this can cause bleeding between periods, and the person may not know what's happened. Others include some harmless changes to the cervix, that is the mouth of the womb, that is the cervical area. Some harmless changes, we call it cervical erosion or cervical ectropion. The inside of the cervix is trying to fold out, and because remember the inside is more softer and the mucous membrane is different from the one of the outside, so the person may start bleeding and will think that she's having bleeding between period, not knowing that she's having cervical ectropion. Some hormonal changes in an individual, especially close to menopause, the period may not occur the way it is, and the person will think that she's having cervical, that is bleeding between periods. Then people with polycystic ovarian syndrome can bleed anytime, and the person may think that she's having bleeding between periods. These are causes of bleeding between periods. Then others include vaginal dryness. When there is vaginal dryness and there is sexual intercourse without enough foreplay, the person may have what we call vaginitis, and those surfaces may erode and may bleed, and the person will think that she's having bleeding between periods. These are causes of bleeding between periods, the main being the cervical cancer. We advise that anyone that is above 25 years and above and is sexually active and has bleeding between period, or even the one we call postcoital bleeding, that is after sex, the person should as much as possible see a doctor to rule out cervical cancer. If the person has not been screening or has been screened and has relatively been okay, she's supposed to return back to the hospital to seek for medical attention, because cervical cancer may present as bleeding between periods. These are causes of bleeding between periods. Other causes of bleeding between periods include endometrial cancer. When someone has endometrial cancer, that is cancer affecting the womb where the baby lies. Remember, it's a tumor on its own. It can start bleeding anytime, and it may bleed between periods, and the person thinks he's having bleeding between periods. Someone that has vulvar or vaginal cancer, any of the malignancies affecting any of this area can bleed intermittently and will give rise to bleeding between periods. Someone that has uterine fibroids, especially the submucous one, the one that stays inside the womb, it can start bleeding because the surface is so high, may overgrow and starts bleeding, and the person will think she's bleeding between periods. So what do you do when you are bleeding between periods? If the bleeding between periods has started giving you concern, I advise you see a medical doctor for review. And part of the things we do is to do a pregnancy test. We must rule out that you are not pregnant, that you are not having a miscarriage. So when a pregnancy test is done, either using the urine or serum, it will rule out whether you have the hormone that shows you are pregnant. Or we can even go on to do a pelvic scan to locate if there is baby in your womb. This will show that you are pregnant, or that you are about to miscarry, or that you have a ectopic pregnancy. A baby that is implanting outside the womb may cause some reactions in the womb, and the person will start bleeding, and the person will think that she's bleeding between periods. So when you see a doctor, rule out pregnancy by doing a pregnancy test or a pelvic scan. We can go on to do vaginal examination. Digital vaginal examination will show if you have vaginitis, dryness of the vagina, if there's any tumor around the vagina. Then we'll have to look too using a speculum. We'll use a speculum to look into the cervix and see if you're having cervical ectropion. It will show on naked eyes, or if you're having some changes around the cervix that may signify cervical cancer. Then ultrasound will also help to rule out if you have abdominal or uterine fibroid or any other tumors around your womb. So these are the things, some of the things that can be done when you visit a doctor to rule out bleeding between periods. Thank you for watching to this point. If you have not subscribed, please subscribe to my page, hit the notification button, share this video. See you next time for another enriching video. My name is Dr. Nkiruka Bridget. I'm a consultant obstetrician gynecologist. I discuss everything about women's health, children's health, and sometimes men's health on my channel. See you next time. Thank you.